Hello and welcome to Dr. Sushant's anatomy tutorial. This is part 2 of knee joint. So let us begin our discussion with the posterior cruciate ligament. The posterior cruciate ligament, as you can see in this picture here, this is the posterior cruciate ligament, this one right here. So this is the front view of the knee joint that has been opened. So the posterior cruciate ligament is seen behind. The one that is seen on the front is the anterior cruciate ligament. So this is the posterior cruciate ligament. Here we can see the posterior. This is the posterior view or the back view, posterior view in the front or the anterior view of the knee joint. So in the posterior view of the knee joint, we can see the posterior cruciate ligament. The posterior cruciate ligament is seen here in this picture. This is the anterior cruciate ligament. Now this is the lateral femoral condyle. This is the medial femoral condyle. All right, so this is lateral femoral, medial femoral condyle. Here also this is lateral, this is medial femoral condyle. Now when you look at the posterior cruciate ligament, it passes upwards, okay, upwards, that is from tibia, because the inferior attachment of the posterior cruciate ligament is below to the posterior most part of the tibia in the intercondylar area. So it passes upwards. Because it is posterior, it passes forwards. So upwards, forwards, and it passes to the medial direction. It passes medially because it will be attached to the medial condyle of the femur. So it passes medially. All right. So the attachments of posterior cruciate ligament, below it is attached to the posterior most part of the intercondylar eminence of the tibia, and then the posterior cruciate ligament passes upwards, forwards, and medially, and it will be attached to antero-inferior part of the medial wall of the intercondylar fossa of the femur. Where is intercondylar fossa? This area is the intercondylar fossa. Which is the medial wall of intercondylar fossa? This is the medial wall of intercondylar fossa, because this is medial wall of intercondylar fossa, lateral wall of the intercondylar fossa. So the posterior cruciate ligament passes upwards, right, forwards, and medially. Then it is attached to the medial wall of the intercondylar fossa. Where exactly? Antero-inferior part of medial wall of intercondylar area. There's another way to say it. It will be attached to the lateral surface of the medial condyle of the femur. Okay, so when you're talking in terms of intercondylar fossa, the ligament would be attached to the medial wall of the intercondylar fossa. But you are talking in terms of the femoral condyles, the posterior cruciate ligament above would be attached to the lateral wall of the medial condyle of the femur. I hope this is clear to you. So in this picture, we can see both anterior and posterior cruciate ligaments, right? So these cruciate ligaments are cross shaped structures. They are cross shaped. That is why they are called cruciform, cruciate ligaments. So here is the anterior cruciate ligament. This is the posterior cruciate ligament as seen in the anterior view of the knee joint. Here is the posterior cruciate ligament, the anterior cruciate ligament as seen in the posterior view of the knee joint. This is an actual knee joint that has been cut open, and here we can see the anterior cruciate ligament passing upwards, backwards, and laterally to be attached to the lateral femoral condyle, and here is the posterior cruciate ligament that passes upwards, forwards, and medially to be attached to the medial condyle of the femur. All right, now let me make things more clear for you. Now we know the cruciate ligaments, right? The cruciate ligaments, they are of two kinds. There's an anterior cruciate ligament, there is posterior cruciate ligament. So the attachments of the cruciate ligaments is very important, and these cruciate ligaments prevent the anteroposterior and side to side swaying of the knee joint. So it provides very good stability of the knee joint. Okay, so when you compare the attachments of anterior cruciate ligament and posterior cruciate ligaments, both are attached to the intercondylar area of the femur above and intercondylar eminence of the tibia below. So now let us try to draw the intercondylar area of the tibia. So this is intercondylar area of the tibia, and here we have this is the intercondylar fossa between the medial condyle of the femur and the lateral condyle of the femur. Okay, so this is lateral, so we have the fibula, tibia, lateral condyle of the femur, medial condyle of the femur. This is the intercondylar area, right? Intercondylar area. Now when you look at the intercondylar area, it has got a, see, this is medial, this is lateral. Okay, obviously this is superior. Okay, so this is inferior for the femur, this is the superior for the tibia, and this is inferior for the tibia. Okay, now I'm going to tell you the walls of the intercondylar area. So this is the intercondylar area or the intercondylar fossa. Intercondylar fossa. So this intercondylar fossa has got the walls. So this is the medial wall of the intercondylar fossa, right? And this is the lateral wall of the intercondylar fossa. All right. So what forms the medial wall of the intercondylar fossa? It is formed by the lateral surface of the medial condyle of the femur. What forms the lateral wall of the intercondylar fossa? It is formed by the medial surface of the lateral condyle of the femur. So this is very important to understand the difference between the structures contributing to the formation of the medial and the lateral walls of the intercondylar fossa. So when you are talking in terms of the intercondylar fossa, the walls differ, and when you talk in terms of the condyles of the femur, the walls differ. So I will clarify this. Now let us first talk about the anterior cruciate ligament. All right, so the anterior cruciate ligament, so we know the attachment of the anterior cruciate ligament and the posterior cruciate ligaments inferiorly on tibia, right? So when you look at the intercondylar area of the tibia, there we have the menisci, right? So we have the medial meniscus with its anterior horn, body, posterior horn, and here is the smaller meniscus, the lateral meniscus with its anterior horn, body, and the posterior horn, right? Then we have the cruciate ligament, right? So we have the anterior cruciate ligament here, the posterior cruciate ligament here. Now I'll make this easy for you to identify these structures here. So this one right here, this is the anterior horn of medial meniscus, right? This is the anterior cruciate ligament. This is the anterior horn of lateral meniscus. This is the posterior horn of lateral meniscus. This is posterior horn of medial meniscus, and this is the posterior cruciate ligament. All right, now when you look at the structures at the intercondylar eminence of tibia from anterior to posterior, the structures would be the anterior horn of medial meniscus, anterior cruciate ligament, ACL, the anterior horn of lateral meniscus, posterior horn of lateral meniscus, posterior horn of medial meniscus, and the posterior cruciate ligament. Now when we are talking about the attachment of anterior cruciate ligament, so the anterior cruciate ligament inferiorly is attached to the intercondylar eminence of the tibia in between the anterior horns of medial meniscus and the lateral meniscus. So between the anterior horns of medial and lateral meniscus is the anterior cruciate ligament. That's the attachment. From there, the anterior cruciate ligament passes upwards. That is, from tibia it is going towards the femur. Therefore, it is passing upwards. So anterior cruciate ligament passes upwards and backwards because it takes attachment from the anterior part of the tibia. It goes to posterior part, that is backwards. So it passes upwards, backwards, and then laterally, passes laterally. So the anterior cruciate, if I were to draw the anterior cruciate ligament, so the anterior cruciate ligament, it goes from the intercondylar area of the tibia. It passes upwards, backwards, and laterally. So it goes in this direction. So this would be your anterior cruciate ligament, right? So it passes upwards, backwards, and laterally. And the attachment, when you talk about the attachment, below it is attached to the anterior part of the intercondylar area between the anterior horns of medial and lateral menisci. Above, the anterior cruciate ligament is attached to the medial surface of the lateral condyle of the femur. Right? Is it not the medial surface of the lateral condyle of the femur? This is the lateral condyle, right? This is the lateral condyle, and this is its medial surface, right? This is medial surface. This is the lateral surface of the lateral condyle. So the anterior cruciate ligament is attached to the posterior superior part of the lateral wall of intercondylar area. Now see, I changed the terminology. When you talk in terms of femoral condyles, anterior cruciate ligament is attached to the medial wall of lateral condyle. When you talk in terms of intercondylar fossa, the anterior cruciate ligament is attached to the lateral wall, that is posterior superior part of lateral wall of intercondylar area. This is intercondylar area. It is attached to the posterior superior part of the lateral wall of the intercondylar area. All right, so I want you to understand this difference when you're talking in terms of femoral condyles, when you talk in terms of intercondylar fossa. All right, so that's the attachment of anterior cruciate ligament. All right, so superiorly it is attached to the medial wall of lateral condyle. In other words, lateral wall of intercondylar fossa. All right, now let us look at the posterior cruciate ligament. So the posterior cruciate ligament has an attachment that is different compared to that of the anterior cruciate. Now the posterior cruciate ligament passes upwards, obviously, because it is going from tibia to femur. So it passes upwards and passes forwards, right? Because it is in the posterior most part of the intercondylar area, and it passes medially. All right. So the posterior cruciate ligament passes upwards, forwards, and medially, like this. All right, passes medially. So what are the attachments? Below, it is attached to the posterior most part of the intercondylar area of the tibia, and then it passes upwards, forwards, and medially. And above, it is attached to the, pay attention, lateral surface of the medial condyle of the femur. Right, this is the femur medial condyle of the femur, and this is its lateral surface. Right, this way is the lateral surface. So the posterior cruciate ligament is attached to the antero-inferior part of the medial wall of the intercondylar fossa. Now see, I changed the terminology. I describe the attachment in terms of intercondylar fossa. So if you're talking in terms of medial, the condyles of the femur, the posterior cruciate ligament is attached to the lateral wall of the medial condyle of the femur. When you talk in terms of the intercondylar fossa, the posterior cruciate ligament is attached to the antero-inferior part of the medial wall of the intercondylar fossa of the femur. All right, so I want you to go through this particular section multiple number of times until you understand. Okay, so the anterior cruciate ligament passes upwards, backwards, and laterally, and it is attached to the posterior superior part of the lateral wall of intercondylar area or fossa, whereas the posterior cruciate ligament passes, okay, and so posterior cruciate ligament, it passes upwards, forwards and medially, right, and it is attached to the antero-inferior. See, it is dead opposite. This is posterior superior, this is antero-inferior. So antero-inferior part of the medial wall of intercondylar area. See, that is also dead opposite. This is lateral wall, this is medial wall. Simply, if you cannot remember any of this, just remember anterior cruciate ligament is attached to the lateral condyle of femur. Posterior cruciate ligament is attached to the medial condyle of the femur. If you cannot remember the details, but do not stick to this particular information, please. All right. So every finest detail in anatomy is very important and it is absolutely fascinating. All right. So next, let us look at the functions of the anterior and the posterior cruciate ligaments. Right. So the anterior and the posterior cruciate ligaments together, they prevent anterior dislocation, anterior and the posterior dislocations of the tibia. Okay. So in order to test this, we have something called the Dreuer's test. So I will talk about the Dreuer's test in some time. Now, what are the functions of anterior cruciate ligament and the posterior cruciate ligament? The anterior cruciate ligament binds the bones together. Which bones? Tibia and the femur. Posterior cruciate ligament also same, binds the tibia and the femurs together. Now the anterior cruciate ligament is stretched during extension. Remember the anterior cruciate, okay? So anterior cruciate ligament, you can relate this by remembering that the anterior compartment of the leg is consists of extensor muscles, right? Anterior compartment of leg consists of extensor muscles. So the anterior cruciate ligament will be taut or stretched during extension. Similarly, the posterior cruciate ligament, so if you remember, the posterior compartment of leg consists of muscles which flex, okay, flex the ankle joint. So posterior cruciate ligament, it will be taut or stretched during flexion. So you can easily remember this. So anterior cruciate ligament is taut during extension. What is this? Taut. Okay, taut means it is stretched. So the anterior cruciate ligament is taut during extension. Posterior cruciate ligament is taut during flexion. Now, the anterior cruciate ligament prevents forward displacement of the tibial condyles. All right. So forward displacement, anterior prevents forward displacement of the tibial condyles, whereas the posterior prevents the backwards displacement of the tibial condyles. Okay, so it prevents the anterior cruciate ligament prevents the tibia from moving forwards, getting displaced anteriorly. So anterior displacement of the tibia is prevented by the anterior cruciate ligament. Posterior displacement of the tibia is prevented by the posterior cruciate ligaments. And both the cruciate ligaments prevent side-to-side movement, the swaying of the tibia, side to side. Okay, side to side is also prevented by both cruciate ligaments. Right. Now, the anterior cruciate ligament, something about the anterior cruciate ligament, it is, we know, taut during extension and it forms a vertical axis for the femoral rotation on tibia during flexion and extension. So during flexion and extension, the anterior cruciate ligament forms a vertical axis for the femoral rotation on the tibia. So these are the functions of the anterior and the posterior cruciate ligaments. All right. Next ligament we are going to talk about is the coronary ligament. Okay, so these coronary ligaments are actually the parts of the fibrous capsule. Right, it's a part of fibrous capsule. As you can see, this coronary ligament can be seen here. So it is actually part of fibrous capsule, and it provides attachment to the peripheral margin of the medial and the lateral menisci. Right, you see this is the medial meniscus, right? Here is the lateral meniscus. So the peripheral part of the medial and the lateral menisci, this is the peripheral part, this is the peripheral part. So the peripheral part of the medial and the lateral menisci are attached to the coronary ligaments, which is nothing but a thickened part of the fibrous capsule. So here a part of the coronary ligament is also seen. This is an actual specimen of the knee joint. So that's the coronary ligament. Very simple. These are the parts of the fibrous capsule which provide attachment to peripheral margin of the medial and the lateral menisci. That's all. Next we have the transverse ligament. This is the transverse ligament. So here is lateral meniscus, here is medial meniscus. All right. So this is the transverse ligament. All right, here is the transverse ligament of the knee joint. So what is this? It extends transversely. Because it is transverse ligament, it extends transversely and it connects the anterior horn of medial meniscus with the anterior horn of the lateral meniscus. Very simple. Right. So we have the medial meniscus, the lateral meniscus. So the anterior horns of these two are connected to each other like this by the transverse ligament. So anterior horn of medial meniscus, anterior horn of lateral meniscus are connected with each other by the transverse ligament. This type of intermeniscal, this is also the intermeniscal ligament. So this is present only in about 40% subjects. All right, not in all. It is present only 40% of the subjects. Which ligament? Transverse ligament of the knee joint. Next we have the meniscofemoral ligament, which is the ligament? Meniscofemoral ligament. Now in this picture you can see this one. This is the posterior meniscofemoral ligament. Posterior meniscofemoral ligament. This one right here. Right. So what is meniscofemoral ligament? So the posterior horn of the lateral meniscus is connected to the medial condyle of the femur by this ligament known as anterior and posterior meniscofemoral ligament. All right, see, this is lateral meniscus, medial meniscus. Sorry, lateral condyle of the tibia, medial condyle of the tibia. So here is the lateral meniscus, this is the medial meniscus. Now what is meniscofemoral ligament? The posterior horn of the lateral meniscus is connected to the medial, this is medial condyle of the femur, connected to the medial condyle of the femur by anterior and posterior meniscofemoral ligament. The anterior meniscofemoral ligament is known as the ligament of Humphrey. Ligament of Humphrey. Whereas the posterior meniscofemoral ligament is known as the ligament of the Risberg. Ligament of Risberg. Okay, so the anterior meniscofemoral ligament passes in front of the posterior cruciate ligament. All right, so this is the posterior meniscofemoral ligament. So the posterior meniscofemoral ligament passes behind the posterior cruciate ligament, whereas the anterior meniscofemoral ligament, that is called the ligament of Humphrey, it passes in front of the posterior cruciate ligament, whereas the posterior meniscofemoral ligament, that is the ligament of Risberg, passes behind the posterior cruciate ligament. So this anterior and posterior meniscofemoral ligaments are with respect to the posterior cruciate ligament. The one that passes in front of the posterior cruciate ligament is the anterior meniscofemoral, and the one that passes behind the posterior cruciate ligament is the posterior meniscofemoral ligament. All right, so what they do basically is that regulate the forward movement of the lateral meniscus during extension. They regulate forward movement of the lateral meniscus during extension. Right, so what is this ALB? ALB is the anterolateral bundle. PMB is the posteromedial bundle. Now, this is Humphrey and the Risberg. So anterior meniscofemoral is Humphrey, the posterior meniscofemoral is the Risberg. Now, the meniscus, medial meniscus and the lateral meniscus. right? So these menisci are also known as the semi-lunar cartilages, okay, and they are white fibrocartilages. This menisci occupy the position between the femoral and the tibial condyles. So femoral condyles, tibial condyles, the interval between them is occupied by the medial and the lateral menisci. All right. So they divide the cavity of the knee into meniscofemoral and meniscotibial compartments. All right. First, let us talk about the medial meniscus. This is the medial meniscus. It is larger and longer anteroposteriorly, and it is semilunar in shape, and it presents the anterior horn, sorry, this is anterior horn, posterior horn, right? The body with the upper concave surface and the lower flat surfaces, medial convex margin, lateral concave margin, right? Now the medial margins give attachment. This is the medial margin, gives attachment to the capsule, that is the capsular ligament, and also it gives attachment to the tibial collateral ligament. So that is why we know if there is a tear of the tibial collateral ligament, it is usually associated with the tearing of the medial meniscus, right? The anterior horn of the medial meniscus is narrower than the posterior horn, okay? Both horns are attached to the intercondylar area of the tibia by ligaments, okay? Now when you look at the lateral meniscus, okay, so the lateral meniscus is smaller, okay, it forms about 4/5 of a circle, 4/5 of a circle, and its parts are the posterior horn, anterior horn, right, and it has got the superior surface which is concave and inferior surface which is flat, and the medial concave margin, lateral convex margin. All right. Now both horns of the lateral horns are of equal size, right, and are attached to the intercondylar area of the tibia by ligaments. Now what happens? The popliteus muscle pulls the lateral meniscus backwards during the initial stage of flexion, and thereby it prevents the lateral meniscus from being trapped, okay, between the tibia and the femur. So these are the medial and the lateral menisci. And let us talk about the functions of the menisci. The meniscus increases the concavity of the tibial condyles for better adaptation with the femoral condyles. It maintains a potential joint space for flushing of the synovial fluid. Presumably, the menisci act as shock absorbers. And the menisci also help in complex mechanism of gliding and angular movements at the knee joint. The peripheral attached part of the meniscus is vascular. The inner free margin is avascular. And this avascular part receives nutrition from the synovial fluid. And very importantly, the semilunar cartilages can regrow if there is any damage happening to them. Now let us talk about very important aspect, this relations of the knee joint. All right. So anterior relations. Anteriorly, we have the quadriceps femoris. All right. So this is anterior, posterior. Okay. This is lateral. This is medial. So anterior relation is formed by the quadriceps femoris muscle consisting of rectus femoris, vastus lateralis, medialis and intermedius. Now anteromedially, the relation is formed by the medial patellar retinaculum. That is nothing but thickening of the capsule, medial patellar retinaculum. Now anterolaterally, the relations are formed by the lateral patellar retinaculum and iliotibial tract. Okay, the iliotibial tract. Now the posteromedial relation. Okay, posteromedially it is formed by the semitendinosus, gracilis, sartorius, and semimembranosus muscles. Okay, here you can see this is posteromedial, where we have the sartorius, tendon of the gracilis, we have this tendon of the semitendinosus, and we have the semimembranous. So this part forms the posteromedial relation. Right, now the posterolaterally it is formed by the biceps femoris. Right, this is the biceps femoris here, and we have the common peroneal nerve. This is the common peroneal nerve. Right, this is the posterolateral relation. Now posterior relation is formed by the popliteal vessels, tibial nerve, both heads of gastrocnemius and plantaris. So this is the posterior relation. We have the popliteal artery, tibial nerve, the gastrocnemius, right? So the medial head, lateral head of the gastrocnemius, right? So this is the posterior relation. So here is the ligamentum patellae, that is derived from the quadriceps femoris, forming the anterior relation of the knee joint. Anterolaterally we have the lateral patellar retinaculum and iliotibial tract. Anteromedially we have the medial patellar retinaculum, and posteromedially these structures, posterolaterally these structures, and posteriorly these structures. So this is the relation of the knee joint. Next, let us talk about the movements taking place at the knee joint. So what are the movements taking place here? We have a flexion, we have extension taking place here, and these two movements take place along the transverse axis, and this takes place in the upper meniscofemoral compartment of the knee joint, above the menisci, right? And there is also slight medial and lateral rotations taking place, and this takes place along a vertical axis, right? And this takes place in the lower meniscotibial compartment, all right, below the menisci, Now the range of movement of flexion is 130 degree, all right, and the range of motion of extension is about 0 to 50 degrees. So there is more range of flexion than extension. When the hip is flexed, with the hip flexed, the range of motion is more. It is about 140 degree. Okay, so this is the movement. So there is flexion and extension taking place along the transverse axis in the meniscofemoral compartment above the menisci. Medial and lateral rotations taking place along a vertical axis in the meniscotibial compartment below the menisci. And the range of motion of flexion is 130 degree. With the hip flexed, it is 140 degrees. And the range of motion of extension is about 0 to 50 degree. Now, what are the muscles producing movements? So this is important. Now, the extension of the knee joint is by the quadriceps femoris, that is, muscles of anterior compartment of the thigh, assisted by the tensor fascia lata. Okay, so it helps to maintain the extended position of the knee. Which one? The tensor fascia lata. Now, what about the flexion? The flexion of the knee joint, the prime movers of flexion are the semimembranosus, semitendinosus, and biceps femoris. That is the hamstrings, right? The hamstring muscles. Now, the flexion is initiated by the popliteus, that is by assisting, that is by, flexion is initiated by unlocking the knee joint by the popliteus, that is by laterally rotating the femur on the tibia, right? And then it is assisted by the sartorius, gracilis, both heads of the gastrocnemius, and the plantaris muscles. Now, what about the medial rotation? The medial rotation is by the semimembranosus, semitendinosus, and we also have the sartorius muscle and the gracilis muscles. Now, the lateral rotation of the knee joint is by the biceps femoris, assisted by the gluteus maximus and tensor fascia lata. So we know in semi-flexed knee joint, the muscles on the medial side, that is semimembranosus, semitendinosus, medially rotate the knee. In a semi-flexed knee, the biceps femoris, which is on the lateral side, laterally rotates the knee. All right, so these are the muscles producing the movements. Okay. Now we come to very important aspect of the knee joint, the locking and the unlocking of the knee joint. Right. So during the completion of last 30 degrees of full extension, okay, it is achieved by the conjunct medial rotation known as the locking or the screw home movement of the femur on tibia. Alright, so this happens, the locking of the knee joint takes place during the last 30-degree extension of the knee joint. This happens by the medial rotation of the femoral condyles on the tibia, and this is called screw home movement. Now, when the flexion has to begin from full extension, the joint is unlocked by the lateral rotation of the condyles of the femur on the upper surface of the tibia. All right. So who unlocks it? It is the popliteus muscle. Who locks the knee joint? It is the quadriceps femoris. So the quadriceps femoris locks the knee joint. Popliteus muscle unlocks the knee joint. Okay, so locked knee is rigid. Okay, the unlocked knee can be further flexed. Unlocking. So after unlocking only, the knee can be flexed. So what happens during locking of the knee joint? Femur rotates medially by the quadriceps femoris, especially the vastus medialis muscle. Okay, and that takes place during the last 30 degrees of full extension of the knee joint. And unlocking of the knee joint is by the lateral rotation of the femur on the tibia, that is done by the popliteus muscle. So this is the locking and the unlocking of the knee joint. Now coming to the bursae, what are the different bursae that we have in the knee joint? So there is the suprapatellar bursa. This is the suprapatellar bursa. It lies above the patella. There is prepatellar bursa, that lies, this one right here, which lies in front of the patella, called the prepatellar bursa. And then there is infrapatellar bursa, that lies inferior to the patella. And then there is semimembranosus bursa. Okay. So what is the suprapatellar bursa? The suprapatellar bursa, it lies between the quadriceps femoris and the lower end of the femur. All right. So this one right here, this is the suprapatellar bursa. This is the ligamentum patellae formed by the quadriceps femoris. This is the femur. So the suprapatellar bursa lies between the quadriceps femoris and the lower end of the femur. We also have the subcutaneous prepatellar bursa. This is the subcutaneous prepatellar bursa. Sorry, not this one. This is the prepatellar bursa, which lies in front of the patella and lies beneath the skin. So subcutaneous prepatellar bursa between the skin and the anterior surface of the patella. When this is swollen, it gives rise to the prepatellar bursitis. Okay, as in housemaids who often kneel down to wash or mop the floor, right? Washing the floor. It is called the prepatellar bursitis, or also known as housemaid's knee. Okay, so that is when you kneel down. So we will talk about it in a bit. So that is the subcutaneous prepatellar bursa. Then we also have the subcutaneous infrapatellar bursa. This yellow colored one is the subcutaneous infrapatellar, lies beneath the skin below the patella. It is the infrapatellar, subcutaneous infrapatellar It is also known as the clergyman's knee. When you just kneel down, okay, when you just kneel down, as in praying, the clergymen do, right, in praying. So you kneel down, so your subcutaneous infrapatellar bursa is swollen in kneeling down position with the trunk upright. Okay, kneel down, trunk upright is clergyman's, sorry, clergy. Okay, it is the clergyman's bursitis, whereas that is subcutaneous infrapatellar bursitis. Prepatellar bursitis is housemaid's knee. This is when kneel down, trunk down, kneel down, trunk down. That is housemaid's knee. Kneel down, trunk upwards is clergyman's bursa. So what are the other bursae in relation to knee joint? We have deep infrapatellar bursa. This yellow colored structure, a deep infrapatellar bursa. Okay, it is deep and inferior to patella. So deep infrapatellar bursa, it lies behind the patellar ligament. This black color structure is like ligamentum patellae. So it lies behind it and at the close to the upper end of the tibia. All right. In addition to this, there are four bursae which lie laterally, and medially 3 to 4 bursae lie around the knee joint. So in addition to all this bursae that I just explained, we have the on the medial and the lateral side additional bursae, not very significant. Right. So next, let us talk about the arterial supply of the knee joint. So the arterial supply of the knee joint is by the anastomosis around the knee joint, and this anastomosis is between the genicular branches of the popliteal artery. The popliteal artery, its genicular branches. What are the genicular branches? The superior medial genicular, inferior medial genicular, superior lateral genicular, inferior lateral genicular. There is also middle genicular branch. So this superior medial, inferior lateral, superior lateral genicular arteries, they anastomose with each other, first of all, and then they anastomose with the neighboring arteries, which are branches of the femoral artery. All right. So from the femoral artery, we have the descending genicular artery and the saphenous branches, right? The descending genicular and the saphenous branches of the femoral artery along the medial side, and along the lateral side we have the branches from the lateral circumflex femoral artery, which is a branch of the profunda femoris artery, and infromedially we have the recurrent branches coming from the anterior tibial, posterior tibial, and the peroneal arteries, the circumflex fibular arteries. So these arteries inferiorly anastomose. So I will talk about the anastomosis around the knee joint in a separate video. So at this point, just remember the arterial supply of the knee joint is by the anastomosis between the branches of the popliteal artery, femoral artery, anterior and posterior tibial arteries, and this provides the knee joint with very rich vascular supply. Even when you flex your knee joint, imagine you totally flex your knee joint. All right, what happens? The popliteal artery, when you flex the knee, it becomes like this, right? So the flow of blood is obstructed, right? Ideally it should be obstructed, but because we have the anastomosis, rich anastomosis around the knee joint, it is not obstructed. So that is the significance of the anastomosis around the knee joint. All right, so the anastomosis is between the branches of femoral artery, anterior tibial, posterior tibial, and genicular branches of the popliteal artery. Next, what about the nerve supply of the knee joint? Now the knee joint is supplied by 10 nerves. There are 10 different nerves supplying the knee joint, and these are the branches of the femoral nerve. All right, there are 3 nerves coming from the femoral nerve. That is nerve to the vasti, vastus medialis, vastus lateralis, vastus intermedius. So these 3 nerves, and we also have the nerves coming from the tibial nerve. So tibial nerve also gives you 3 genicular branches: superior medial genicular, middle genicular, inferior medial genicular nerve. So that is 6. And we also have the branches from the common peroneal nerve. There are three genicular branches from the common peroneal nerve, which are the superior lateral, recurrent, and inferior lateral nerve, and one branch from the obturator nerve. The obturator nerve, that is from its posterior division of the obturator nerve, which is known as the genicular branch. So genicular branch from the posterior division of obturator nerve is the 10th nerve. So these are the nerves that supply the knee joint. So how many nerves supply the knee joint? 10 nerves. What are they? 3 from femoral nerve, 3 from tibial nerve, 3 from the common peroneal nerve, and 1 from the obturator nerve. Now let us talk about the stability of the knee joint. All right. So these cruciate ligaments maintain antero-posterior stability. So they prevent the anterior and posterior displacement of the tibia. Remember, the anterior cruciate ligament prevents the anterior displacement of the tibia. Posterior cruciate ligament prevents posterior displacement of the tibia. Now we have the collateral ligaments. What are the collateral ligaments? The medial collateral ligament or the tibial collateral ligament, the lateral collateral ligament or the fibular collateral ligament. They maintain the side-to-side stability. All right, and this fibrous capsule is strengthened from all aspects, and it adds to the stability. For example, anteromedially of the medial patellar retinaculum, anterolaterally we have the lateral patellar retinaculum, right? And also laterally we have the iliotibial tract strengthening the fibrous capsule. So all these provide additional strength to the fibrous capsule. So it is strengthened from all aspects, and that adds to the stability of the knee joint. And the iliotibial tract, of course, it plays an important role in stabilizing the knee joint. All right, so these are the factors that basically maintain the stability of the knee joint. Now it is time for the clinical anatomy. So I will discuss the clinical anatomy in part 3 of the knee joint.